When you're pregnant, some of the most exciting times are when you get to see your little one through an ultrasound. But sometimes it can be pretty confusing as to when you'll have one and what the doctors are actually seeing. I spoke with an OBGYN who explains it all.
For a normal pregnancy that doesn't have any risk factors, usually I will do an ultrasound between 7 and 8 weeks. At that point, you can tell that there's one baby, the baby's in the right spot, and the baby has a heartbeat. It's not really Facebook-worthy photo. The baby just looks like a little kidney bean with a heartbeat, but most moms are really excited to see that first picture, and then I can confirm their due date.
Dr. Courtney Barnes says finding out the due date is very important.
Lots of things later in pregnancy really depend on that due date. So if something comes up like your blood pressure goes up or you have diabetes that requires insulin, sometimes we'll deliver people at a certain gestational age and you really want the most accurate dating possible.
She says not all healthcare providers do that early ultrasound. Some wait until a little later in the pregnancy when they're screening for things like Down syndrome, which happens between 11 and 14 weeks.
Later on, and between that 11 and 14 weeks, we're actually measuring the thickness on the back of the baby's neck. That's called a nuchal translucency measurement, and that is increased in things like Down syndrome or trisomy 21. And then at the 20-week scan, we're looking at everything. It's really amazing, all of the things you can see. You can see the 4 chambers of the heart and the kidneys and the brain structures and all the long bones.
The 20-week scan is for many families the most exciting.
So at the 20-week scan is generally when people will find out what they're having, if they're having a boy or a girl, and then if all of the anatomy looks normal.
But some families don't wait that long to find out if they'll be buying pink or blue paint.
There is something called cell-free DNA testing, which sounds like new agey science, where we draw the blood of the mom and we actually harvest out the fragments of the fetal DNA. And we can kind of string them all together. I almost think of it as gluing them all together, and we can tell if the baby has increased risk for trisomy 21, but we can also tell if it's a boy or a girl. So people really like that test. And that's done between 10 and 12 weeks of pregnancy.
To learn more about when Dr. Barnes says you might be able to feel your baby kick and when others will be able to, find this story on our website, krcgtv.com. For more of our mom-to-mom conversations, tune in every other Wednesday.